Good afternoon, Minister. Minister, Monday I asked you a question in the legislature about St. Mary's Hospital, and specifically its Regional Cardiac Care Center.
Yep.
Of course, St. Mary's, is a world-class hospital, regional cardiac care center in Ontario with world-class staff. I don't need I could spend the 20 minutes bragging about them, but I'm not going to do that. Minister, back in 2012, John Malloy promised and made a commitment to deliver on an expansion of their cardiac care center. In fact, making it, as it stands right now, it remains the only one of the 11 full-service regional community hospitals in Ontario that is still waiting for an EP lab. It was promised in 2012. Minister, why is it after 4 years not been built?
So, all right. So, as I think you've referenced, the support that was publicly announced a number of years ago, and there's no question that the Ministry and the LHIN are both supportive of the proposal from St. Mary's Hospital for a new arrhythmia program.
Yeah.
So there is capacity planning currently underway by the Cardiac Care Network that will support this, and base operational dollars will be made available by the provincial programs branch in the ministry once the capital expansion is complete. And the capital project, that capital expansion is being recommended to proceed.
So, I mean, we're now 4 years later, so you're telling me that the hospital obviously submitted the proposal, the LHIN, the ministry have approved it. Now, CCN, the Cardiac Care Network, has also approved the capital and the operational dollars. What's left? Like, what are we waiting for? Has the hospital received documentation from CCN for this project to at least, be tendered? I mean, we're at least 18 months away from seeing the facility open. So, after its original promise, we're looking at, 5.5, almost 6 years before we get something done. Can you validate, what you just said there, I suppose?
So, so this is and to some extent, this is a stepwise process. It's not that we have been inactive since 2012. That's the time, you're right, when our government communicated its support in principle for a full arrhythmia program at St. Mary's. In that same year, we provided St. Mary's General Hospital with just under $1 million in base funding to support patients from the area that had received their implantable cardioverter defibrillator or ICD implant outside the region, and then returned and received at St. Mary's support for monitoring and follow-up care. In 2013, St. Mary's, with government support, launched their implantable cardioverter defibrillator program formally.
And I don't want to cut you off.
No,
I've got 20 minutes or less because my colleague wants time here as well. So walk me through the process as to which.
But that's part of the arrhythmia program, right? And so what I'm trying to demonstrate is that it's a stepwise approach.
Right,
in
but
fact,
we need the capital to actually commence the construction process.
So, and I'm telling you that the capital funding has been recommended to proceed.
So and I understand there is a significant process, clearly, and that's obvious. When will, now that that's done, what will the next steps be, and how long roughly will, the hospital have to wait until they get the paperwork from the CCN to begin the tendering process?
Well, I can't speak to the precise dates, but I have to, I should point out that it was in July of last year that the Cardiac Care Network reviewed the proposal for an advanced arrhythmia program at St. Mary's, including ablations. They reviewed it. I have the results of the review in front of them. But it really is, I think it's important that from 2012, when the approval or the government support in principle was provided, that there has been significant activities that take place, part of which there's a requirement to sort of mature and expand and develop the capacity where you move.
We're somewhat locked with the ability or the capacity based on the room availability, and the expansion is required. I mean, again, we're the last one of the 11 full-service regional cardiac hospitals that have been waiting for this lab. In fact, you look at the CCN numbers posted.
Yep.
The provincial wait times for some cardiac procedures are the longest wait times in the province. Some 51, in some cases, 51 days people are waiting, and in Mississauga, 8 or less in some areas. And so
that's why we're building the program.
A significant priority to make this happen. And so, I mean, give me a rough idea. You should have maybe the deputy or other folks can help me understand, if July they reviewed it, it's good to go. We're 18 months away. If you told us today, when can the people of Kitchener-Waterloo and St. Mary's, expect to see some sort of documentation that'll enable them to commence this project? Not only the capital commitment, but the operational commitment, and I'm assuming one follows the other, right?
Yeah. Do you want to add to this, Deputy?
Yeah, thanks, Mr. Harris. So, as you know, the provision of electrophysiology services within an EPS catheterization suite is one of the most complex services that can be provided from a capital basis. And in order to get the capital approvals, in order to ensure the mechanical, electrical, the air handling, et cetera, are there to protect patient safety, there's a fairly substantial approval process necessary on the capital side. I can promise you that the discussions to enable the provision of those services and develop that EPS suite are underway. There's often quite a bit of back and forth, understanding what the base situation is in the hospital, understanding the improvements in air handling that are necessary. Often takes our staff quite a bit of time to make sure that patients are being provided with safe and effective care. So those discussions are underway. You're absolutely right that once the capital facility is constructed, the operational dollars are there. As the minister says, operational dollars to the electrophysiology program are already flowing. And the arrhythmia program starts off with implantable cardiac defibrillators. It then moves on as staff are recruited to EPS cardiac catheterization facilities. And that program takes time.
Yeah, but we've had, fortunately, we've had, EP specialists recruited by the hospital. Unfortunately, they came and were waiting for this and have left. We're lucky enough to now have another one that started just this spring. Yep. My fear is that we could end up losing this individual if we don't have a clear commitment from your government. Yeah, we understand the discussions, but it's the paperwork that the hospital needs and the community needs, the acknowledgement. We've got the promise. We need the paperwork to allow us to continue to get on with the capital. When can people of Kitchener-Waterloo expect to see the commitment, the paperwork that basically allows them to put the tender out to the street? When will that be? In the next month, 2 months?
So you wouldn't want to have a tender out in the street before the base conditions are understood and the various elements leading to an appropriate RFP process are there. So those discussions are currently underway. That back and forth between the hospital and the capital branch is fully engaged until that understanding of base condition and exactly what modifications to the hospital are required,
It's kind of the cart before the horse, I suppose, or what have you, but you know what, again, Minister, when will the people of Kitchener-Waterloo receive, I guess, the final, when can they expect, we've heard the promise, we're waiting for the paperwork. Can we expect to see that in the next 60 days? I hear the discussions. I mean, people kind of tired from hearing about the chit chat when we've heard the promise back in 2012. How much time do I have left? 10 minutes, good. Maybe we'll get it out of them in 10 minutes.
So, the paperwork can go out very readily once the description of the services required in the base hospital and exactly what's required for an EPS-ready cardiac catheterization suite is understood. It's not a problem with paperwork with respect, Mr. Harris. It's an understanding of what needs to be done and exactly what the characteristics are of the RFP are. Do you need to replace the chiller in the base hospital? Do you need to replace
Well,
the
the
blower
chillers
on the
are
roof?
relatively new there, but anyways,
But-
I guess there's a lot of planning, but I mean, they need the green light, you know what? And I don't think that they have seen any green light that they can move forward. I mean, I'm just wanting to get some commitment. from
Yeah, and I don't mean to be argumentative, but with respect, the green light starts with a planning process between ensuring that the standards that define appropriate service delivery within capital structures are being met. The hospital understands that. The ministry understands that appropriate safety conditions, appropriate terms of service will be provided, and that then defines the RFP. So the paperwork is not an issue. It's not a bureaucratic process. It's a process of assuring quality in the development of new services within a hospital capital structure.
I mean, I'm confident they've got the capabilities there to perform the services. Again, you know, it's one of the last full-service cardiac centers. You'll see the diagram that's posted, missing the EP suite. And so, you know what, I think I've made my point. You know what, we need to get on with this. We're 18 months away from opening a door, you know what, and we've waited long enough. I mean, we're serving 1 million patients in the region of Waterloo out of St. Mary's. We're crisscrossing other LHINs to provide world-class cardiac care, and yet, you know, we're still waiting from an announcement that was made in 2012. This is unacceptable, and I just ask that you make a commitment to deliver on a promise that was already made, especially in an area and in a hospital that has the expertise. They're ready to go. They just need an answer from you folks. So I'll leave it at that one at that. I think I've been pretty clear on it. I look forward to seeing you. Minister, have you been to St. Mary's Hospital?
I have, thank you. Okay. But if you'll allow me
That's a
to,
yeah. You have been to St. Mary's?
if you'll allow me, so a lot has taken place since 2012, including substantial multi-million-dollar investments by this government. As I mentioned, the cardiac care network, as they're required to do, reviewed the proposal, this specific proposal that was received last year. They reviewed it beginning in July of last year. I've indicated that we are recommending it to go ahead
That's
for
great. I
the
mean,
capital,
the
as
promise
well
in
as the
2012 was
operating that would flow afterwards. And so if you'll just allow me, and so it really is, and this is not specific to this particular activity. I just had a conversation with the 3 MPPs from Windsor, for example, about their proposal for a hospital, that there's
8 minutes.
that it's critically important that both parties agree on precisely what comprises this project. And that's the back and forth that we're having. So it's not an issue of will we fund it or not, or whether the capital is available or not. It's just reaching the conclusion so that we're actually providing the highest quality service
I
that's
encourage, and I
needed.
know the hospital will make their folks available with your people to get this underway. 2012 announcement, took to 2015 to review plan. Anyways, you hear where I'm going
Yeah,
with this?
I do.
And I hope
Thank
to
you.
see you at St. Mary's Hospital soon. I'm sure they'll have a ribbon and scissors ready for you whenever you get there.
And you.
So on to that, we just briefly touched on fiscal year ends for hospitals. And I asked you briefly if there will be hospitals that will in fact report a deficit this year. And I believe you did concur with that. I'm wondering if you can tell me how many hospitals across the province that are likely in a deficit position that in fact will report a deficit this fiscal year.
Yeah, I don't believe that I did, at least.
All right, will there be
No,
hospitals?
but I don't, just as a point of clarification, I don't believe that I did indicate that there would be hospitals in a deficit position. And I'm not sure whether we even have that information yet at this point.
Well, I mean, fiscal year end March 31st, have there been any signals to the ministry from the LHINs that in fact hospitals in the province are likely in a deficit position or will have asked or sought permission to get a waiver for last fiscal year?
So we've just received audited financial statements from all the hospitals, and we're working on the consolidation on a provincial basis, so we would not have that information
So you have
currently.
received audited statements. Are there any that have in fact provided audited statements that show a deficit?
So I don't have that information in front of me right now, but we can probably see if we can get that information.
To your knowledge, or have you been informed by staff that any hospitals have in fact submitted deficit audited statements
I have not been informed by staff that that's the case
by any?
at this point.
Now, we know across the province, there are some hospitals that prior to their fiscal year end, especially in the cardiac care end of things, that performed additional procedures that maxed out their, I suppose it's their funded targets prematurely, were given acknowledgement from the province that they would continue on with those procedures and that the government would in fact cover the difference. How many hospitals in Ontario would have been in that position?
I don't know. I mean, Bob, you might be, I don't have knowledge of the specific number, but, so this is based on, there are a number of procedures that are funded based on volume, as you've indicated, and it's probably.
Do we have a list of
We might have
those?
the answer for you. That we provided additional funding based on volume-based funding, correct?
So there are 19 hospitals receiving services that are volume funded within comprehensive cardiac programs.
Cardiac.
So there's 19 facilities that will receive additional funding.
Sorry, that's the number of total advanced cardiac centers that perform services that are volume funded. That's the number. In terms of the number that received extra funding, I don't have that information in front of me.
No.
I guess my question is, what is the process to which, a hospital, gets approval to carry on with procedures, and the government, the ministry, agrees to cover those? Like, what is the process then by year end to cover that off?
So maybe I could start that and then turn over to Assistant Deputy Minister Lynn Guerrero, who has responsibility for provincial programs, including Cardiac Care Network. So there are a variety of programs that are volume funded that are estimated based on historical performance.
Yeah, no, I know.
This gets trued up subsequently.
I guess I'm curious, so how many of those hospitals will report a deficit this year? Do you know? Do you have that information?
In cardiac care?
Just hospitals in general, audited statements, hospitals will
With
submit.
it, but I've already mentioned that we have
don't
just received their audited financial statements. We're working on the consolidation of hospital accounts.
So what is tell me what the process is for, if a hospital were to provide, the hospital has a shortfall, and the government's made a commitment to cover that shortfall, what is the process as to which they go about doing that?
I think Lynn can speak to that.
I'm just curious on how it works.
Hi, it's Lynn Guerrero. I'm the Assistant Deputy Minister for Negotiations and Accountability Management. I think I mentioned maybe last week or a couple of weeks ago that we did do a piece of work in 15-16 with all of our cardiac centers with respect to some volume pressures that probably the vast majority of them were having with various procedures.
Yep.
Throughout the year, there was a very transparent process where all facilities were engaged in conversations with the ministry and with Cardiac Care Network, where we did some work around how best to manage volumes to the best of everyone's ability within their facility. We also did some work around transferring volumes between one facility and another, because sometimes certain hospitals had issues and others did not, and we want people to get care closest to home and not necessarily be transferred to another hospital.
So how have you funded the delta then on some
So
of
there
those?
was, after we did the reallocation and after we asked people to reforecast the volumes that they would be doing,
Yep.
we made a commitment that if people, and they did tons of work with us, and the hospitals did a great job reforecasting, we made a commitment if they could try to stick to those reforecast numbers that we would commit to paying for those volumes.
Okay.
We actually have given hospitals up till the end of June to submit their volume data. So we actually don't have the data yet with respect to which hospitals may or may not have gone over that amount.
So what happens
But for
when
those
they-
that do, we will fund those procedures. So for hospitals that, even with, notwithstanding the tremendous work they did to try to manage their volumes, if they still went over in certain cases, we will pay for
So
those
what happens
volumes.
when a hospital has to file the year-end statements by tomorrow? And where's that funding gap come in? How do you,
I'm not sure how they're filing their year-end statements.
So I can
how's that
tell
gonna
you,
work?
do you want me to tell you as a
Yep.
former CEO?
Yep.
So you work with your external auditor, and there are variances, there are footnotes that are, generally speaking, the ministry is always considered to be good for its
So have
its
you issued
commitments.
letters to those?
So those,
folks?
generally speaking, there's a letter, I'm sure we provided to these hospitals as to their estimates of what the funding allocation would be. They then true it up after financial year end. The hospital demonstrates to the accountant has done the cases They demonstrate on the letter those cases will be paid for. They're included as approved revenues and achieved revenues within the fiscal year and go
So
into
those
the,
letters have gone in?
they would have gone out.
We've been corresponding with hospitals about their projected volumes and the plan to move them around. Once we have final volumes in from hospitals, they will get letters that support that funding.
By the end of the month?
When we get their volumes by the end of the month, I can't give you a date by which
For
the letters
last
will go
fiscal
in.
year?
For 15, 16.
But in terms of the audited financial statements, what will often happen is that we will have sent a letter saying, here's a commitment to fund those cases. The hospital demonstrates to the auditor the cases are accomplished,
Okay.
and they're achieved revenue within the hospitals in your accounts.
Thank you, Dr. Bell. Thank you,
Thanks, guys.
Mr. Harris.